Good afternoon, everybody. Welcome to our webinar on return to work, the working environment in COVID times. Before we get started, we'll just do some introductions. There's a few familiar faces, but we have a couple of new ones as well. So I'm Greg Guilford. I'm the CEO of HR Solutions, and I have Atima Arden, our digital marketing executive as well, who's supporting on this webinar. And the new face of our health and safety offering is Dominic Greenwood, and he'll be the main presenter today. And Dominic's just going to give you a bit of an overview about his history before we move on with the webinar.
So good afternoon, everybody. My name is Dom Greenwood. I'm the new Senior Health and Safety and Environmental Management Consultant. Spent most of my career, in fact all of my career actually, in the leisure and fitness industry, holding positions at general manager level for a number of fitness and leisure providers, DW Sports Fitness you'll have heard of, the gym group, and latterly in the community leisure and charitable trust sector. But over the last 9 years, I was head of compliance, group safety, quality for the Energy Fitness Network, looking after circa 100 plus clubs across the UK, Ireland, Scotland and Europe. So it's a bit about me, just going back to Greg, and you'll hear from me shortly.
So in terms of the agenda we're going to run through today, just going to quickly summarize that for you. So we're going to have the introduction, which is the current landscape, welcoming staff back, the employer's duty, what do you need to do, tools you can use, what else you can do, how HR Solutions can help, and also we'll signpost another webinar that Dominic's already got lined up for you. Those of you who've been on our webinars before, hopefully you know how to ask questions, but obviously you're all muted, I'm afraid, at the moment. It just makes the whole webinar management a bit easier, but we do want to have you ask as many questions as you want. Dom is new, so go easy on him, but what we would like you to use is the chat panel in your GoToWebinar app that should be on your screen. There should be a little box there that says questions. It may be a grey line, but you might, if you expand it, you'll be able to ask your questions in there. And what we'll do throughout is take a pause and ask those questions answer those questions at the relevant point. If not, we'll try and answer as many of them at the end of the webinar as well, and we'll remind you throughout the session to get those questions in. So I'm now going to pass you over to Dom, who's going to run the rest of the webinar.
Can you see my screen? I'll show you my screen. So the current landscape, we're still very much in COVID-19 waters. The virus is still very much out there. And only yesterday we heard about new guidelines that are going to be kicking in from Monday. Talk about only 6 people to be able to meet inside or outside in the UK. However, and the main reason for this webinar really is many businesses, industries and service providers are looking to reopen. They're looking to generate income and fulfill contracts that were either signed before, maybe during lockdown and more recently. So they're looking now to invite many colleagues, staff members back to work. And as the general public venture out more, there's going to be more of an expectation that services that they once enjoyed will be back up and running, probably to the level that they were. And obviously that may or may not be the case going forward. But I think the main reason for this webinar is that employers need to make sure that they've made suitable and sufficient arrangements. There's a duty of care over staff, there's a duty of care over anybody that accesses the building, the facility, or the business. So a big part of this webinar is to think about maybe what things, components, assessments maybe need to be put in place to hit that component and make sure things are suitable and sufficient. So we're going to start with a poll, which I'm going to hand back to Greg to set up.
So if you want to just click your slide forward, Dom.
Sorry. Oh, what I did forget to mention was this the new normal. We're all hearing about the new normal. It's not a term I like at all, but we're all getting used to something that is going to be new and we're going to have to live with for a period of time.
Okay, so that the first poll is, have your staff return to work at their previous place of work? So I'm going to launch the poll now, and that should result in a pop-up on your screen, and you should have the option of just simply yes or no. So have your staff return to work at their normal place of work, yes or no. We're just waiting for respondents to come through. So most of you have replied, a couple more still to go. We're just going to give it a few more seconds. Okay, most of you have done it now, so I'm just going to close that poll. I'm going to share the results. So you should be able to see on your screen that most of you, 60% of you, have said yes, have your staff return to work. Yes, they have, and 40% obviously saying no. So it's a mixed result there. So I'll pass you back to Dom to progress with the webinar.
Yeah, so the reason for that first poll and the first question really is that we now know that 60% of you have invited staff back. So, and for the 40% that haven't, there may be a time in the future where that will happen. So we're thinking really about what you need to do to make sure that your business workspace, work site is obviously compliant. So welcoming staff back, more and more businesses are now reopening and welcoming their staff back. However, there are some important things to consider to safeguard staff and visitors to the premises. And as I've already touched on, the employer's duty is to the people and their own employees. And under Section 3 of the Health and Safety at Work Act, this places a duty on every employer and self-employed person to conduct their undertaking in such a way as to ensure something that is called reasonably practicable, which means that you've gone as far as you possibly can in assessing all the risks and dangers to safeguard anybody really that's in the building, site, or where the staff are going to be. So this duty is intended to protect an employer, contractor, subcontractor, and indeed your own employees. And in fact, it actually is anybody that can be affected by the employer's work activities. That's not me saying that, that's it in the Health and Safety at Work Act. And obviously part of welcoming staff back would be that you've made those secure, suitable and sufficient arrangements. Going to pose a second question straight away there and hand back to Greg, but have you completed a COVID-19 risk assessment for your business? Simple yes or no.
Okay, so Dom's asked the question there for you. So have you completed a COVID-19 risk assessment for your business? On your screen, you should have yes or no options. I can see the results already coming in pretty quick with quite a positive reaction. I'm just going to leave it a few more seconds for a few stragglers. Okay, I'm going to close that poll now and share the results. So a resounding 88% of you have completed a risk assessment related to COVID-19 for your business, which is great to hear. There's 12% of you obviously yet to do that yet, but maybe perhaps you're in that group that haven't returned to work yet. So I'm just going to hide that and pass back to Dom.
Fantastic. So it's great news to hear that 88% of people have, business owners, managers, operations managers, health and safety managers have completed a COVID-19 risk assessment. And as Greg's already said, maybe the 12% of people that haven't fully opened or invited staff back so far. But you know, what do you need to do? And the first thing is complete a COVID-19 risk assessment, which should identify and contain the COVID-19 method statement. And there's a variety of ways you can do this. There's a number that are available online, and obviously we've got some as well that can be used. I think something that we're really conscious of is that every company should have a competent person who will oversee all parts of the process. So this person needs to be identified really by chief executive, managing director, and operations director, and it could indeed be that person as well that is going to manage all parts of the staff returning to work, and indeed making sure they're safe when they have returned to work. We're hearing about this all the time, aren't we? Social distancing, it's the new thing. But implement social distancing in the workplace, which can be easier in some businesses than others. In an office environment, it may be easier than in a manufacturing plant where machines are in a certain place. They could be bolted to the anchored to the floor. Assembly lines, for instance, could be far more difficult to social distance on than maybe a call center where an easy option could be moving desks. That in itself could be a problem due to technology, cabling and things like that. So it's just really thinking about how you can socially distance your workplace, and so people are still staying at least 2 meters apart if that is at all possible. Cleaning is a real big one. So have you implemented cleaning schedules in the workplace? Pretty sure everybody's got either cleaning teams, self-employed cleaners coming in, or indeed a cleaner. But have you actually looked at the cleaning schedules in place? And these cleaning schedules really should detail high risk areas, high touch point areas, high traffic areas. As you know, I'm from the leisure and fitness sector, and one of the last jobs I did before leaving was implement a cleaning schedule. And you'll appreciate in a fitness and gym environment, fitness equipment is being touched all the time. It's the very nature of how somebody uses the equipment and trains. So the cleaning schedules had to be really looked at carefully, but also ramped up in certain places, higher frequency, looked at different products and things like that for staff. So think about looking at your cleaning schedules in and around the workplace, staff areas, kitchens, and anywhere that people are going to be potentially congregating under a social distance method. Sanitisation stations, again, we're hearing about these all the time, and again, this can happen in a number of ways. You've got the automatic sanitisation dispensers. Some place I've been to over the last few weeks have literally just got a table set up in the maybe the foyer or the reception area, and then that's then replicated throughout the facility with a variety of wipes or antibacterial gel, alcohol-based gel of over say 60%, and or cleaning products for equipment. In Tesco's, they have sprays for shopping baskets and things like that. There's no kind of hard and fast rules on this one, as long as you've got some kind of sanitisation stations. And I would say as well, to accompany that maybe with signage, so that everybody can see, everybody knows where the sanitisation stations are, and also how they work. A big problem I'm seeing at the moment, certainly going back to the fitness industry, is when the industry reopened on the 24th of July, clubs and leisure centres had loads and loads of sanitisation stations, but over the past month or so, they're gradually running out. They haven't reordered the antibacterial gels that go in the dispensers. Sometimes they're empty. Sometimes, unfortunately, they're going walkabout as well. They're being taken for home use. So again, this competent person really needs to have some kind of maybe check sheet, or understand how to order more products and understand how that works as well. Just talked about signage, but the signage on this piece is really more directional. So use signage to inform staff and customers on changes in direction around the workplace. You may think about maybe a one-way system in and out of the building. You may even use a different door to egress the building to which people entered the building. So think about actually letting customers and staff, visitors, know what to do. They may be used to going a certain way round, and you've now changed everything in line with social distancing. So directional arrows on the floor, directional signs on the walls. As important, inform staff and talk to your staff so they can then let people know exactly where they're supposed to go and what they're supposed to be doing. And then something called the EAP, the Emergency Action Plan, which I'm sure everybody's got a version of, but has it reflected these particular changes? Has it reflected the fact that you're now not using the main door, for instance, to egress from? You're now using the door at the back of the building. Think about reviewing that. It should be reviewed annually anyway, but think about reviewing it now. If staff have come back, it might be worth doing that. And if they're coming back shortly, it might be worth doing that before they come back. Sit down with staff, tell them what's going on. Explain to them that the emergency action plan's changed and things have moved around, and maybe fire extinguishers aren't where they used to be, because they're going to need to know what's going on, and you need to make sure that these documents are reviewed. Again, this is just following government guidance. Advise coverings in any face coverings in any public areas. You may have decided in your risk assessment that you've taken, which is point 1 of this slide, nobody needs to wear a face covering, because at no point does anybody come in contact with anybody else, and there's no communal areas. But equally, you may find that there are corridors, meeting rooms, staff rooms, or whatever, where staff are going to be moving around, and or the public may be accessing the building. So you might decide to enforce facial coverings in any public areas. And then this link to that one really is providing PPE. Again, it's a buzzword at the moment, PPE, personal protective equipment for all staff that would be operating in public areas. And maybe you've got staff that are going out to sites, visiting clients. They may be going from site to site. It'd be good practice to provide those staff with their own PPE, so that you know that they've got everything they need to be safe. And then really some kind of, and we've all heard of the test and trace system, recording the details of any visitors that have been on site and holding that for around 21 days is what is the guidance I've been getting. So could we, or could you, should you be told that someone had accessed the building with positive coronavirus symptoms and then they've tested positive, is there a way you can tell and inform anybody that's been in the building over the last couple of weeks, and certainly probably the last 7 days? So it could be something as simple as a spreadsheet. It could be an online app that you could download. There is something called sign-in app that you can use as well, where visitors sign in on a tablet and then holds all of their details on a register, and you can then print that out to a file and then use that to contact people. So it'd just be good practice to record the details of any visitors that you've had on site maybe for the last 7 days, and then hold that information for 21 days. So there's a few tools you can use. There's a COVID-19 self-assessment, which will identify any gaps to help you make the workplace COVID secure. We've got that, and I think we're quite happy to share that document. It covers about 7 or 8 different areas of the operating business. There's some parts that pertain to statutory compliance, which would be good practice as well. And it just gives you almost a red, amber, green visual about where you might need to focus your time as and when you're welcoming staff back. But also, if you have welcomed staff back already, it might just be a good refresher to use. There's a COVID working safely guide, which I'm hoping some of you have seen before. It's an HSE publication. There's a number of them, to be honest, and depending on which sector you're in, you could download the one that pertains to yourself. But this is an overarching working safely guide, and if you don't do anything with it but use it as a guide, maybe you print it out, maybe you have it in the office, maybe you share it with staff. I think it's just a good tool to use that's free and is up to date. Download, complete and display the COVID secure poster, and we've all seen these as we've been moving around our localities and back to work. So staying COVID-19 secure. What I would say is don't just download it and put it up, and I've seen that a few times, unfortunately. Actually do what they've asked you to do. So there's 5 or 6 different statements you as an owner, maybe managing director or CEO are going to commit to, and you're then going to display that for staff and visitors, guests, members to see. And it just really gives them a sense of confidence and security that you've done everything you possibly can to make the workplace safe in line with governmental guidelines. Guess what? The highest ranking officer is going to sign that, and then it just gives everybody a bit of confidence. And then think about maybe implementing a COVID-19 health and safety check sheet, and this is just one of many with probably 12 to 15 different points on, and it could be something that's done on a daily or weekly basis. It could be something that's done before the factory or the retail outlet or the office opens. It could be something that you share with staff and involve staff, so they actually buy into the reasons that we're doing this kind of check sheet. It'd also be good practice to do should you get any kind of enforcement visit or regulatory visit. And again, should anybody ever test positive and you get asked to provide anything, if you've got check sheets available that are dated, you can then go back and say, yeah, actually we've done sanitisation, we've implemented the cleaning schedule, we've implemented meetings or whatever it might be. So keeping check sheets, it would be good practice. And then we've recently just developed a new form called a staff and visitor declaration form. Very straightforward. Again, there are a number available. I think it'd be good practice to implement that to anybody accessing the building, just so they commit to a declaration that they haven't been to any kind of countries that are on our list. They have socially distanced. they're not displaying any positive signs, and they've been to see a doctor, they've had a test, and it kind of covers a lot of ground. And again, it's just a good tool you can use, and you can again save those. Need to think about GDPR as well, because obviously we're taking personal data, but again, they can be destroyed within 21 days as well of that person entering the building. So good practice would be staff and visitor declaration sheet. So there's 5 or 6 tools there that you can use, and again, we'd be more than happy to support businesses and owners with all of these tools. Pretty sure you've seen this one. This is the new message from the UK government. There's been a number, haven't there? And this is the message that appears on the lecterns at the press conference every day. It's now turned to hands, face, space. So it's changed slightly, and the wider message is, wash hands, cover face, make space. I think what I would suggest is, let's all start doing that, so that all businesses are doing that, and I'm pretty sure a number are already. The whole hand washing thing was massively promoted back in the early days of the virus. If we wind the clock back to sort of March, April time, there was a big campaign on hands. I'm hoping everybody's still doing that. The new one is the facial coverings in public areas, and obviously now it's the space as well. So there's a couple of visuals there for you. There'd be no harm in printing those out, putting them on a health and safety notice board in your workplace, using those as part of staff meetings, talking to staff about them. Just make sure that everybody is aware that this is the new government guidance, hands, face, space, and yeah, just making sure that everybody is doing what they're supposed to be doing. So what else can you do? I think a real big one would be involve your people. Your people are the lifeblood and the beating heart of your business, whatever business that would be. If they weren't there, you probably wouldn't have a business. So let's involve them, communicate with them, train them, and support them. They need to feel safe and supported and understand what they can do. More than anything, listen to them. Just remember, these guys have been maybe furloughed for a number of months. They may be a little bit nervous about coming back to maybe what a new way of working. Everything is slightly different. They also may have been through some kind of trauma, or maybe family, maybe bereavement or something like that throughout the lockdown. So it'd be worth communicating with them, reaching out and finding out how they feel about coming back. And even if you've already welcomed your staff back over the last month or two, it's worth just seeing how they're feeling about everything. So maybe weekly meetings, maybe you've got a WhatsApp group, maybe you've got some other way that you're talking to staff, but above all, listen to what they have to say, because I think, if you don't know how they feel, then it's very difficult to then plan for the future. Check. So don't just rely on the policy, the procedure, or the check sheet. So businesses are really, really good of having files full of information, check sheets, policies and procedures, but do we really know, as a management team, as an operational team, and maybe as a director team or CEO team, that things are actually being done as they should be? So as an owner stroke manager, you need to check things are working as they should be. Go back to the floor, have a walk around, talk to staff, talk to operations managers, check things to make sure that everything that we say we're doing, we are actually doing. Maybe you could think about working patterns and limit staff movement. So consider rotating shifts. I'm sure many of you have already thought of this already. Or think about maybe using a team A, team B scenario. So week 1, Monday, Wednesday, Friday, team A are in. Week 2, they're in Tuesday and Thursday, and things rotate round. That may not be possible, depending on the business that you're running, but it might be that you can change things around. You could also think about using different rooms. If you've got maybe training rooms, meeting rooms, board rooms, whatever it might be, to try and socially distance people. And then limit staff from moving around the workplace, and think about different buildings, and only allow essential trips, and only you can do that. But I keep going back to the risk assessment. Let's make sure that the COVID-19 risk assessment picks up all the natures of your business, where staff go and what they actually need to do. And there's a couple of guidance links there as well, and I think this is going to be going out, or we can send this out with the links on, and I'm sure you've accessed them before, but the HSE are changing things all the time, and that particular link is linked to social distancing in the workplace. And the second link there, which I think is really good, is there are now 14 user guides that cover pretty much all the industries we have, from farming to retail to office space to contact centres to sports and leisure, garages and factories and things like that. So it'd be worth accessing that link if you haven't already done so, and try and find the guide that is as close to your business as possible. Print it out, share it with your staff, have a look at it, make sure that all your processes and procedures are in line with the guidance that they're suggesting. But those 14 guides are really good. They're free, which is even better. So absolutely no reason not to take advantage of those 2 links there. There are others, Public Health England as well, but these are the 2 that I found most useful when doing things prior to this. And you'll be pleased to know you're going to get a rest from me, because we've got a 3rd question to ask you. So question 3 would be, do you have a nominated competent person in health and safety and fire? I'll hand back to Greg.
Yeah, thanks for that, Dom. So I've just launched that poll for you. So do you have a nominated competent person in health and safety and fire? And it's yes and no. Just while we're waiting for those to come in, so we have a couple of questions already come in, but this is the last poll. So if you want to get any more questions in for Dom to answer, then please use the questions panel, and we'll answer those at the end of the session. So most of you have responded now, so I'm going to close that poll and share it. So there is 84% saying yes, they do have a nominated competent person, and 16% saying no.
Okay, yep, so very, very similar to the previous poll there. Again, it could be because of the 16%, they haven't returned to work, or they haven't started back the way they were. What I would say is it is a legal duty under both UK laws to have a competent person. So under both UK laws, the Health and Safety at Work Act 1974 and the Fire Safety Reform Order 2005, a competent person is a legal duty. Not only is it a legal duty, it's what you'd want to do. So let's have this person in place that's going to really make things work, be the cog in the machine, really, that makes things work on a health and safety level, so that all staff can feel valued in what they're doing, but also creating a safe and secure environment. This is how we can help. We're going to start running nationally accredited training courses, which can be accessed in 2 ways. There is an online version that's going to come out at some point, but at the moment we are delivering courses in workplaces, socially distanced, of course, with all the control measures in place. And there's a number, in fact, there's 5 that we are going to be running as from next month. So I'm going to be delivering level 2 health and safety, which is a Safe Cert nationally accredited course. It's a 6-hour course designed for operational managers, supervisors and owners, but really anybody could access that training and really benefit. Level 2 fire safety / fire warden. By attending the fire safety course, you also get a fire warden certificate, so it's a dual course. And again, it will come as no surprise, we talk about fire legislation, the fire risk assessment, fire prevention, and at the end of the day, get to use fire extinguishers in a safe and controlled way. Staff seem to like doing that in the car park. Level 3 first aid, so the emergency first aid at work course, or first aid at work, we're going to be offering as well, accredited by the first aid industry body. Level 3 safeguarding, I think it's really important to think about safeguarding in the workplace, not only staff, but any members, visitors, guests, contractors that come in and they could be vulnerable. So this is, again, a 6-hour course accredited by Ofqual. It's a really, really good course that talks about all the indicators of potential safeguarding issues that can take place in the workplace. And the last one we're going to be offering is level 2 and/or level 3 mental health first aid. I attended the trainer course a few weeks ago, and it was by far the best course I've ever been on. Really opened my eyes, and I can't wait to be delivering that in and around our businesses, because I think there are so many different mental health issues in the workforce that if employers knew or could recognise some of the signs at an early stage, they would really stop that from escalating or developing. And not only would it stop absenteeism from work, but it'd just make that individual feel so much more valued, and that they want to come back to work and be a really positive part of the team. So mental health first aid would be the fifth course we're going to be offering. So please do get in touch if there's any of those courses that would help you in your business, and I look forward to hopefully delivering some of those in your workspaces soon. There's a few other ways we can help, and again, we've put together a free online COVID-19 self-assessment tool, and what the tool really does, it just shows you where you might need to focus some time. It's question based, and again, it's kind of a yes or no answer, much the same as the polls have been today. But it'll give you some focus about where you need to spend some time, and give you some ideas about what you need to do to hit the criteria. It's a free tool. We're going to be sending that information of how to access that, so it's definitely worth using it. Talk to us, get in touch, because we're going to be providing a free 30-minute health and safety phone call to discuss your workplace. At the moment, I don't know many of you, so it'd be great to talk to you. And if you want to take advantage of the free 30-minute call, I'd be more than happy to talk to you about whatever it is that you may have a gap in your workplace on fire safety, health and safety, safeguarding, training, whatever it might be. So please do consider the free 30-minute call. We've developed a COVID-19 risk assessment template, which again we're going to be uploading, and people and companies, clients can access that for free. We're more than happy for you to access that. Equally, if you'd like me to come out and do it for you, or help you with that, support you with that, the offer is there to do that. And again, I think I mentioned earlier in the presentation, we've developed a staff and visitor declaration sheet, which we are going to be allowing to go up on our knowledge base, so that clients can access that for free and start using it, along with the workplace check sheet, which I think I alluded to earlier in the presentation as well. These are all tools that we think are going to make your businesses far more compliant, and make staff, visitors and users feel more safe and secure. So there's a few tools there of how we can help. Moving on to the next webinar, because we've pretty much come to the end of this one. We're going to be talking about statutory compliance and the law, Wednesday the 28th of October at midday. On that particular webinar, we're going to be talking about maybe the 14 or 15 statutory items that you need to be a compliant owner stroke manager under UK legislation, and we're going to kind of think about how you can hit those, and if you haven't got them, how we can help as well. Just like to say thanks for listening. I'm hoping it's been useful. More than happy to take some questions at the end. Please do get in touch. Looking forward to meeting some of you in person at some point. And I'll hand back to Greg to finish the webinar.
Great, thanks, Dom. So for everyone who's on the call, Dom's only been with me, well, not even a month. So I think today's his month anniversary, actually. So this is his first webinar with HR Solutions, so hopefully he found it useful. We are already keeping him really busy. As you can see, he's developed quite a few documents for our clients, and we'll be uploading those, making those available to you as well. We also encouraged him to run another webinar, which he's just promoted on the screen as well. So we have got a couple of questions that come through. If you do have any others that you want us to ask Dom whilst he's here, then please put them through whilst I'm talking. But if you're ready, Dom, I've got a couple of questions to ask you.
Yep, let's do it.
So we've got a question from Karen. She's saying, we are a small business, 20 people divided over 2 floors. We've considered restricting the downstairs team to the use of the one toilet on that floor. Do you know what's the maximum number of users or men per toilet, if there's any sort of recommendations or guidance out there that they can be signposted to?
Thanks, Karen. The simple answer is no. I haven't seen anything that would suggest a minimum or maximum number of people to use a toilet. And the reason I say that is because I went through quite an extensive piece of work for the fitness industry I worked for previously. And as you can appreciate, in gyms, leisure centres and health clubs, toilets and changing rooms are of paramount usability. So I'm more than happy to look into it and try and feed back to Karen if we've got the details. But off the top of my head, I don't think there is anything. I think it all goes back to the key document, which is the COVID-19 risk assessment. And the reason I say that is a little bit like a fire risk assessment. Every business is different. Some businesses could have 10 toilets, some could have one, and anything in between. So I think it all goes back to how you have assessed and rated your business, and then the control measures that you're going to be putting in place, and then sticking to those control measures.
So the other things consider like hand sanitization in those toilets, I guess,
Yes,
if they are high used areas, making sure that there's soaps available, and probably encouraging people to clean up after themselves. So clean before, clean after, so that toilet is in good state for whoever goes in there afterwards, which is
we'll totally agree with
good practice generally anyway. But I hope that answers your question, Karen. So we've got another one that was, Karen's found the link on the toilet. I will share that with people in the chat. Do you need to record the details of delivery drivers? And that's from Renee.
Again, I think officially no, but I think it would be good if certainly if they're coming in the building, and then again, every company is different. I know some companies that won't allow delivery drivers in the building. They have to leave all the parcels and deliveries outside. They then get put into a plastic container that's then lifted into a secure room and then unpacked. I also know some businesses that allow the delivery driver to walk up 3 flights of stairs and deliver the package to the person's desk. So again, it depends what your current company policy is. My view would be, if you can keep as many people out of your business, as the better, because you're then minimizing the risk of the contamination. Certainly if delivery drivers are coming in, they should really be wearing PPE, their own PPE, masks and gloves. And quite a number of the big operators I know people that work for the big operators that are doing that. It'd be worth keeping a log so you can then ascertain what time deliveries come in and by what company. But again, I think it goes back to the risk assessment, and deliveries is part of the risk assessment. For anybody that's going to use the one we've produced, there is a delivery section on there, and you can then change or manipulate that part of it. Greg.
Great, thanks. One more question from Karen. She's asking if you can point in the direction of where she can find a good version of the COVID secure poster, because the ones she's managed to see online are a bit grainy and have a bit of grey in there where you need to sign them. Have you got any good links?
Yeah, so one of those links, if you go on the link that, well, we could actually send it out, Greg. To be honest, I've got a copy anyway. But there's for anybody else on the government HSE website, which allows you to download. There is it was one of the icons earlier in the presentation, the little blue booklet.
Mm-hmm.
As part of that booklet is the poster. So you can then either download it or save it to a PDF and just print it independently, which is exactly what we did in the fitness network. So you can just download them independently, and they come out really well, blue and white. But get it from the HSE. I think it's called Keeping COVID Secure in a Working Environment document. But we can probably put it up, Greg.
Yeah, as you say, we'll add it to the follow-up email from this webinar. So Dom alluded to quite a few pieces of free stuff. So we will also put the links to where you can download those as well into the follow-up emails from this webinar. Thank you for everybody who asked questions. If you do have any other questions, then you can reach out to Dom. His details are on the screen. So Dominic G at hrsolutions-uk.com, and he will try and arrange a call with you to just talk through any of those questions you've got. Like you said, we're offering free 30 minutes to try and talk through anything health and safety. We will look to try and gain feedback on this. Obviously, it's Dom's first health and safety webinar, so we are looking for Dom to start to run regular health and safety webinars as well as our normal HR ones. So if there's topics that you'd like to hear from Dom, then please do let us know on the email that follows. For those of you who are already on our newsletter list, you'll know that we have been providing legal updates on HR, but we will be adding health and safety news to that list as well. So if you haven't already subscribed, then please do. So it's simply hrsolutions-uk.com/newsletter sign up, but that link will be on the follow-up email as well. That just leaves me to thank Dom once again for his webinar with us. I hope you found it all useful, and thanks for everyone that attended. It was great to see some familiar faces on that attendee list. And just if you have any questions, then please do let us know, and we'll provide all the links that we've mentioned throughout the webinar. So thank you for your time, and I'm going to now close the webinar.
Thanks, everyone.